In the past, there would be treatment of patient based upon structural change. Now remember, the structure is demonstrating that which has happened already, cell death that has occurred. Because of the nature of pattern ERG, it's showing you how the function is deteriorating before cell death occurs. Therefore, if we have this device that's actively monitoring if a patient's getting better or worse, you now have the ability to look at the response and say, is my treatment adequate? Have I reached a functional point that I'm satisfied, or do I need to do something more? And that is demonstrated in a much more timely fashion with pattern ERG than with the other modalities.
We have noticed a significant difference in our patient outcomes. It has changed how we do things in our electrophysiology clinic and in other clinics at the Oklahoma College of Optometry since we've got the Diopsys Nova system. We've had a number of patients that we have started on treatment because of the results of this testing and the ability to show the patient an abnormal reading. You know, the problem with visual fields and other testing is the damage is often already done. So by the time that you start treatment and lower their pressure, you're not seeing a reversal of visual field defects. You're not seeing a reversal of OCT defects. What's been really cool and interesting in our clinic is we've been able to show patients an abnormal visual evoked potential, or VEP, an abnormal pattern electroretinogram or pattern ERG, and we start treatment, and 6 months later, a year later, to show an improvement in that test is outstanding and very exciting for the patient, and it's a great education tool, and it helps with compliance. You're taking your drops, and look what's happened with this better test result.
We all have those borderline findings, whether the patient's low risk, depending on how many risk factors they have, or high risk. And for those patients, we may, once we have this objective data that says these cells are sick, I would be more likely to start the treatment earlier for that patient. And so yes, it does change our clinical outcomes depending on what that test says. This objective data, we're not dealing with, oh, I had a bad testing day. This gives us results that helps us in our decision making.
We've absolutely noticed a difference in our patient outcomes as well as our management of our patients ever since we've incorporated the Diopsys Nova system. From a visual evoked potential perspective as well as now a pattern electroretinogram perspective. I think my partner's quote is probably the best of all, which is one of the first cases that we had that we really would not have treated had we not had the visual evoked potential. His quote after that patient was, "This is why we bought the Diopsys system."